All right, so there's another thing I want to really talk to you about because as long as you brought up removing a lot of breast implants, and we're doing more of it, talk to me about what people can expect once they've had their breast aug removed. And obviously, you probably can guess where I'm going with it. How natural will the original breast look
Yeah.
after, and how, is it after 5 years? It might be, the chances are this, after 10 years. I mean, can you put any texture on that?
This is a very difficult answer. So when I do most surgeries, I look at what they have. I can really give them an idea of what they'll look like afterwards, right? When I'm removing an implant, I
Right.
don't know. I don't know. So part of it will depend whether I take out the scar tissue or not, whether I do an in-block removal, whether I just take out the implant. So that will all play a role on how the ultimate breast will look. But how that person's body heals will play a role. How big of an implant was in there? How much breast tissue they still have?
How long was
If
it
they
in?
have a 700 cc implant in and they were an A cup and they have a thinned out breast tissue, how's that going to look afterwards, right? So we don't always know. We have guesses. So there's options. So when you're going to make a decision, so you make this decision now that you've had implants for this many years, X years, and you've decided it's time to remove them. Well, your surgeon should go with discuss with you the options. One choice is to remove the implant, maybe even replace it with a smaller implant, right? Maybe size was the issue. Another option would be to remove the implant, maybe do a lift right at the time of surgery and try to reshape the breast so it's more cosmetically pleasing. Third option, maybe remove the implant, see what you ultimately have, see how your breast bounces back. Mm-hmm. And then at that time, maybe 6 months, a year later, after you see exactly what you have, do your lift, which may be a better lift because you actually see how the skin is contracted.
Maybe just go over what a lift is, and
Right.
because maybe I know you mentioned it, but if people don't understand what you're talking about.
So breast lifts are relatively common in plastic surgery. Breast drop for all different reasons. Their breasts could be form dropped, or they drop as people gain and lose weight, or after pregnancy. So the goal of a breast lift is to reposition the breast tissue back to where it used to be. And that typically involves scars that can be as small as a small incision over the areola. It could be around the areola, down the vertical portion of the breast, or around the areola, down the vertical portion, and across the fold of the breast, which I think is the most common, and that's called a wise pattern mastopexy.
And what percent of people that have their implants removed follow up and get a lift?
So in my practice, it's very common. I'll advise them. But you got to remember, Jonathan, it depends what their breast looks like when they're coming into me, right? So if they're coming in and the breast is already hanging way, way low, and they have then I know that patient, if they tell me they don't want a supernatural droopy breast, they may want to have a lift right at that time.
But again, out of 100, how many?
I often advise patients
the majority
to get the implant out,
and get
to wait and see what that breast will ultimately look like. Often we get surprised, and they do way better than they think.
I see.
And I would say probably if I had to put a number on it, I would say 70 to 80% never come back to do a lift later.
Wow. So it's only a small fraction.
Yeah.
So,
but it could be argued or debated either way. There would be some plastic surgeons who would say, well, why put them through this? If you think they're not going to be happy, why not just resolve the issue right then and there and lift the breast? But I do think there's consequences. When you do lifts, it involves a lot of scars. So I don't think it's a bad idea to sometimes just remove them and see what they'll look like, unless you know for sure and you feel very confident that they're not going to be happy.
But I mean, I hate to say, but there is a financial advantage to doing a lift when you remove a breast. Is another
not
reason.
major.
Okay.
So if you do them at the same time, some people believe it'd be a lot cheaper.
I see.
But we pay a certain amount per hour in the operating room, and
so
it
that's
doesn't
not
change
driving
tremendously. And personally, for me, if I've done the implant removal and that patient comes back a year later and wants to lift, I would give them that same discount what they would have saved if they would have done it.
So it's not with you, but so that's not the driver. So if someone's saying,
when you do a lift on a patient, you've got to understand you are usually cutting around the areola, down the middle, and across the fold. there's real scars on the breast. So there is a trade-off.
So if you can
So
avoid,
if you're making that trade-off, not quite knowing what your breast would look like without
that's
that implant,
amazing. Yeah.
you sometimes may be better off to see what it would look
Yeah.
like.